Ladies and gentlemen, welcome to the Humans in Space virtual finalist selection. Today, we'll have a pitch session for 5 equity investment applicants, then 3 minutes break, and our last pitch session for 3 orbital large funding applicants. My name is Derek Lee, an investment manager here at Boreum, and it is my pleasure to be your moderator for this wonderful event. Before we start with the pitches, I'd like to introduce our esteemed judges. If I pronounce your name incorrectly, please correct me. It's my pleasure to introduce Cesare Rubascio, Space Exploration and Science Innovation Lead, Senior Expert at Life Support and Habitability at Thales Alenia Space, and Dr. Charles Chu, Professor of Laboratory Medicine at University of California, San Francisco, and Dr. Hak-Soo Choi, Professor of Radiology at Harvard Medical School, and Dr. Israel Viran, Co-founder and General Partner at Earth and Beyond Ventures, Dr. Jens Haus-Lage, Associate Professor at DRL, Dr. John Allen, Director of Medical Standards at Star Harbor, Martina Tuscio, Entrepreneur, Consultant, Startup Mentor and Judge, Mika Menz, Founder and CEO at Actual Plus, Dr. Patrick Hollis, CEO at LiveGraph, Dr. Paul Carmen, Managing Director at Space Pharma, Shisha Venkapol, Founder and CEO at Halogen, Stephanie Shovelin, Vice President of Strategy and Business Development at Aurelia Institute, Victor Shubakovsky, General Partner at Beyond Earth Venture. All right, I hope everyone is ready for today's main event. Again, just a reminder, for each presentation, we'll have 3 minutes for pitch. Then we are going to be moving on to the 5 minutes Q&A session. If you have, thank you for your presentation, Core Vision. We'll move to OUI Medical, our next presentation. OUI Medical,
Recording in progress.
Innovative disposable laparoscopy device. Please welcome OUI Medical.
Good morning, everyone.
OUI Medical, do you have a control over the presentation now?
Yeah. Good morning, everyone. I hope my slides are visible.
Sorry?
My slides are visible and I'm audible.
Yes.
Yeah.
Yes.
Yeah.
Thank you.
Thank you and good morning, everyone. I am founder of OUI Medical and I am presenting P-Scope, world's first scope for abdominal cavity examination. Well, abdominal cavity examination in space is a major challenge. On Earth, we rely on ultrasound, X-ray, CT scan, MRI and PET scan to evaluate abdominal problems. However, these options are not available in space. So we have developed a scope to examine abdominal cavity under local anesthesia. So we give a local anesthesia on the abdominal wall and this is the device. It's completely disposable. We introduce it under vision, and once we are inside, we pump some atmospheric air and we can introduce the scope inside. We can have a look. These are the intestines. Take a biopsy. It has a irrigation suction as well. Release all the gas, take out the port, and the patient is completely awake. This is basically performed under a local block in the bedside setting. So it's ideal for deep space exploration. It's compact, weighs only 2 kgs. It can be rapidly deployed and it is easy to operate and it's disposable. So it has many applications in space, especially in deep space exploration on lunar, on Martian basis. So for evaluation of abdominal problems, management of abdominal trauma, women's health, and it also has applications in onboard scientific research for taking biopsies or monitoring tissue healing in space. and it's a platform technology, so we can adopt various other scopes like a cystoscope, bronchoscope, etc., to broaden its applications. On earth, it has applications in sepsis management, in staging of abdominal cancers, management of abdominal trauma, etc. So we have already received an FDA clearance for our device. We have granted patents all over the world, and our business model is we contract manufacture these devices at $200, and we sell these devices at $2,000. We need to generate 500,000 procedures to generate $1 billion revenue. So total market size for endoscopy globally is around $40 billion, and the SOM is around $4 billion, and the endoscopy market is growing at 17% annually. So we are raising around 2.5 million to get to product market fit, then raise another growth round, and probably we aim to get to 200 million by 2030. So I am Dr. Adarsh. I'm a minimal access surgeon. My co-founder Thomas has 3 exits in medtech. Rachel and Ashley come from marketing background. We are also tied up with Space Medical Accelerator, and we work with Dr. Goto with respect to space medicine aspects. So this is a device that can substitute major devices like a CT, MRI, ultrasound, or a laparoscopic tower or X-ray in space. It is a life-saving application, and I believe it should be a must-to-have application for deep space exploration. Thank you very much.
Thank you for your presentation, judges. If you have any questions, please let me know. Yes, Patrick?
Yeah, thank you. So you really had like this terrestrial traction now, but the operation is by a human. So on the development side, is any kind of autonomous or robotic operation is in the plans? Because I imagine that in an emergency situation or in space operation, someone has to check something very quickly. Would it be able, is that on the plan? And do you see the market that somehow you would integrate this to autonomous robots and medical robots?
Well, this is just a diagnostic and therapeutic device and not to perform surgeries. So it has a limitations on that. So, however, this can have a telemedicine facility wherein these images can be transmitted to ground, and we can guide those people for the diagnosis and treatment. So we don't have any plans as of now to integrate with robotics.
Right. So it needs an operator. So if someone is
it needs an operator.
Thank you, Jens.
Yeah, thank you very much. So when you talked about disposable, and when I think about closed systems, also space, what's about recycling and reuse of such a device in space? So when I think about to have 10 or 15 of them in a store, but what's about recycling?
Yes, usually it's possible to ETO and use it. However, again, having an ETO in space is a challenge. So we believe disposability is the ideal way to go ahead in space, actually.
Okay. Yes, Victor?
Yeah, thanks so much for the pitch. So my question is, how many devices have you already sold in 2024 and 2025?
No, we have received our FDA clearance last year end, and we are raising funds to get to market. However, we have received a lot of interest from American College of Association of Surgeons. So we are getting to market and we are raising funds for that.
Okay, but I noticed that you mentioned that you had some revenue in 2024 and 2025. Is it right?
No. So we don't have revenue yet. We are pre-revenue. So we are raising funds in 2025.
Okay, got it. Thank you.
Yes, John?
Thank you. Ultrasound's currently in use, as you all know, in space station has been for some time, and it's usually done under the supervision of somebody terrestrially. How easy is this to perform by the non-medical personnel?
Ideally, this is an invasive procedure, So ideally, a medical professional would be ideal. Either a nursing staff or a physician would be an ideal person to do this procedure. It's diagnostic as well as therapeutic. For example, liver lacerations or spleen injuries, you can go inside and install some hemostatic agents, and or also you can rule out in puncture injuries, you can rule out any intestinal injuries. So it's more so diagnostic and therapeutic applications. And the platform can be again, you can attach an bronchoscope, cystoscope, or it can also work as a hysteroscope. So that platform can be again broadened to for multiple applications.
Thank you.
Yes, Israel?
Yeah, hi. Thank you for the presentation. Is there competitors doing something similar? This is one question, and the other is, do you have patents on this?
Yeah, so this is a novel device, and we have granted patents in India and Australia already, and our patents and pending in all the other major economies across the globe.
And competitors?
No, we don't have a direct competitor for this device. So it's a novel device. However, we indirectly compete with CT, MRI, and laparoscopic sets. So those are our
Yes.
indirect competitors.
Thanks.
Thank you.
Is there any further question? Okay, so thank you for your presentation, OUI Medical.
Thank you.
We'll be moving to